Today, we delve into a fascinating and perhaps underreported complication associated with a common procedure in equine medicine, the intravenous placement of over-the-wire catheters. This technique, frequently employed in horses for various medical needs, generally boasts a good safety record. However, like any medical intervention, it carries potential risks. One such risk, the unintentional loss of the catheter's guide wire within the horse's bloodstream, has been a subject of anecdotal discussions among veterinary professionals, but surprisingly has limited representation in formal scientific literature. Our exploration today is based on a recently published study that aimed to shed light on this very issue. It highlighted that a significant proportion of cases in their study, 62%, achieved successful guide wire retrieval, either through venotomy or image-guided percutaneous removal. They also observed that guide wires located within the jugular veins were more readily retrieved compared to those that had migrated to the heart or surrounding vessels. The fact that successful retrieval occurred up to 4 days after the initial loss, in some cases, suggests that immediate, frantic intervention might not always be necessary. Drawing parallels with human medicine, the researchers pointed out that in humans, lost intravenous guide wires are often discovered incidentally years later during unrelated procedures, frequently without any associated clinical abnormalities or complications. They're finding that all 5 horses with guide wires left in place returned to their previous levels of activity without complications further supports the idea that intravenous guide wire loss in horses might not be as immediately life-threatening as some anecdotal reports might suggest. The study also briefly touched upon the Seldinger technique, the standard method for over-the-wire catheter placement, both in human and veterinary medicine. While this technique enhances safety by reducing the risks of air embolism and vein damage, it is associated with a certain rate of complications, including guide wire loss.